Hi everyone, Dr. Fink here. Today we'll talk about fertility protocols for patients on TRT or individuals who are using anabolic steroids. Quick disclaimer, this is not medical advice, this is entertainment only. So as you might know, if somebody is taking anabolic steroids or TRT, testosterone replacement therapy, our own testosterone production, sperm production shuts down to a certain extent, sometimes completely, and this happens because our body senses excess amounts of testosterone and shuts down our own production. And that happens via the hypothalamus-pituitary axis that release luteinizing hormone LH and follicle stimulating hormone FSH that stimulate testosterone and sperm production in the testes. All right. So if we inject testosterone, our body, our hypothalamus will sense, oh, we have too much. So pituitary gland will release less of those LH and FSH hormones that will trigger the release of testosterone and sperm production, and we become infertile or badly impaired. That's generally how it works. However, after cessation, after we stop testosterone replacement therapy or steroid abuse, we can start producing healthy sperm again if we follow certain protocols. And those protocols are it depends on each individual how they react to those protocols, but there are certain general steps we might consider following. Okay, so let's assume somebody was on testosterone replacement therapy or was taking anabolic steroids for a couple of years. First thing they need to do if they want to recover their fertility is to stop those drugs. Okay, so testosterone replacement therapy or anabolic androgenic steroids, stop. Next thing we want to consider is taking HCG. HCG stands for human chorionic gonadotropin, which is basically mimicking the LH hormone, luteinizing hormone. And luteinizing hormone is basically responsible for testosterone production in the Leydig cells of our testes. So if we inject HCG, we basically trick the body into thinking that we are releasing luteinizing hormone and we produce more testosterone, intratesticular testosterone in our testes. Okay, and we might consider doing that for, let's say, 3 months, and then we can reassess our blood values and our sperm values. What values should we look at? Luteinizing hormone and follicle stimulating hormone and testosterone are a must, so we can see how well our testosterone production is recovering, and with FSH we can see how well our sperm production is recovering. And these values, by the way, should also be taken at the start of the fertility protocol, so right after cessation of TRT or steroid use. Okay, so we have an initial start point of LH, FSH, and testosterone, and we start with HCG, and then about 3 months later, we reassess LH, FSH, testosterone, and sperm quality. Okay, so sperm quality can also be assessed at the beginning. However, it might be very low. The quality of the sperm, the motility might be very low. And then after 3 months of HCG treatment, we can reassess all those values and see what improvements we made. HCG dosages for an initial treatment range between, I would say, 1,000 and 3,000. I use 2 to 3 times per week. That's again dependent on each individual, but usually that's a common dosage. So what happens after 3 months? Let's say sperm quality, motility has improved a lot. and LH, FSH are back to normal, well, then fertility might happen anytime soon and you should be ready to go. Otherwise, let's say they are recovering somewhat, but they're not there yet. So you should, or you could consider doing another 3 months of HCG and then reassess LH, FSH, and sperm. However, if LH, FSH, and sperm do not react at all to HCG treatment alone after 3 months, you could already consider introducing recombinant FSH or HMG. So those drugs are basically mimicking the FSH hormone. So FSH is directly telling the Sertoli cells in the testes to produce sperm. So remember, LH is just telling the Leydig cell to produce testosterone, which can then trigger a sperm production. But if this doesn't work, FSH and HMG can be more potent indirectly working on the Sertoli cells to increase sperm production. So now you might ask, what's the difference between FSH and HMG? FSH is recombinant, so it is artificially made in a lab, and this is basically the same thing as the FSH we produce naturally, released by our pituitary gland, and HMG is basically extracted from the urine from pregnant women, and it contains FSH but also some LH. Which one is better? It all depends on availability, on pricing, but usually they are similar in the effects. What are the dosages? 75 to 150 IU 2-3 times per week. So after 6 to 9 months, this protocol should lead to recovered LH and FSH and sperm levels. So the introduction of FSH or HMG depends on how you react to HCG or if you need it at all. It all depends. Some people go 3 months on HCG, they see small improvements, then they do another 3 months, and at 9 months they back fertile. So that works for them, only HCG. Some people try that for 9 months or 6 months, and then they don't see much improvement, and they want to introduce FSH or HMG at that point. Okay, so it all depends on how fast you want to see results, how your body reacts to HCG, and this again depends on each individual. But in general, you should recover between 6 to 12 months after initiation of either HCG alone or HCG in combination with either FSH and HMG. Okay, so when I mentioned here 75 to 150, that is in combination with the HCG treatment. It always depends on the dosage and the length of the testosterone replacement therapy or steroid use period. Let's say a bodybuilder who heavily used anabolic steroids for decades, he might need more time, maybe even more than a year on those drugs until he recovers. Sometimes they don't recover at all if the usage was too heavy. But generally, if it's a testosterone replacement therapy dosage and it is a couple of years, then those individuals should recover with either of those drugs or a combination of those. Not either of, but with HCG or a combination of HCG and FSH or HMG. All right. So I hope this was helpful, and please let me know what you think in the comments down below. Thank you for watching.